Good afternoon, everyone, and welcome. Before we start, I would like to begin by acknowledging the traditional custodians of the lands across the Loddon Mallee and pay my respects to elders past and present. We honour the leadership and wisdom of First Nations women whose voices are central to the future in this region. And indeed, I wanted to take a moment to explicitly acknowledge that Aboriginal women have been healers on the lands of the Loddon Mallee for millennia, and contemporary healthcare and society at large has much still left to learn from these practices. So it's a real privilege to be here online with you all today to reflect, to learn, to imagine what comes next for Women's Health Loddon Mallee. We do meet at a time of tremendous change. Public conversations about gender equity have become more divided, even as national and global research continues to remind us that equity is essential for thriving communities, for strong economies, for healthy families. Here in the Loddon Mallee, we see these truths every day. You know, our geography is vast, the challenges are real: distance from services, cost of living pressures, climate and workforce strain, persistent rates of violence. But what defines us, I think, is not the challenge, it's the response. It's the strength of women and gender diverse people in this region, the creativity of our community, and the belief that we all have that a fairer, safer future is actually possible. And really, that's why Women's Health Loddon Mallee exists, you know, not just to advocate, but actually to catalyse that change, to elevate lived experience, to connect strategy to community, and really just to keep the fire burning even when the conversation becomes difficult. You know, we have a really strong legacy built on activism and courage. For decades, Women's Health Loddon Mallee has been bold, leading cultural and structural change across this region, and that spirit remains our greatest asset. So today, as we gather in shared purpose, I want to honour the people who make this organisation what it is, our board, our partners, and especially our dedicated staff. Your commitment and passion drive every step that we take. And while this AGM is about accountability, it's also about possibility. It's about planting the seeds of the next chapter and asking what sort of future we want to help create and what sort of courage it will take us to get there. So thank you all for being a part of the Women's Health Loddon Mallee story and for believing in a region where every woman and gender diverse person can live safe, well and free. So I look forward to the conversations ahead. And before we move on to those conversations, we've got some formalities, which is, first of all, the acceptance of minutes of the previous annual general meeting. So I wonder if I can put to the floor anyone who's happy to pass those minutes and second. Do we have anyone who's willing and able to do that?
Yeah, Melissa and Andrea.
Oh, perfect. All right, so with that done, we'll move forward to the Chair's report. The report is available online, and I think we'll be popping the link in the chat in just one moment for you. There it is, so that you can have a read of that if you like. As the Chair of the board, it's really been my honour to write this report, and because it's been a year of both reflection and renewal, actually. We've really honoured our history, but also prepared boldly for the future at the same time. As I mentioned, you know, for decades, Women's Health Loddon Mallee has been a force for equity in this region, a feminist organisation built on advocacy, courage, and the belief that healthier, safer communities are possible, and particularly possible when women and gender diverse people are empowered. And this year, I think we really deepened that commitment. A lot of our focus was around strengthening our governance and our strategic capacity to ensure that Women's Health Loddon Mallee is well positioned for the next chapter of our journey. And to do that, we sought wisdom from respected past leaders of the organisation, including people like Anne Somerville, Karen Riley, and Dr. Helen Kelleher, and reminding us that our history is not something to admire from a distance, but actually something to learn from, build on, and carry forward. So across our region, while we do continue to face real pressures, social, environmental, and economic, I think we've responded with clarity. I think as an organisation, we've stayed grounded in our core purpose, ensuring emerging work strengthens rather than dilutes who we are. And we've also recognised the shifting political and social climate. As mentioned before, public debate around gender equity has become more contested. And that actually only reinforces why organizations like ours have to be courageous, why we have to speak our truth, we have to elevate evidence, and why we have to centre the lived experience of regional and rural women and gender diverse people. So looking ahead, we are preparing the next iteration of Women's Health Loddon Mallie's strategic plan, and this is our chance to again think boldly, to imagine not just what's needed today, but actually to sort of create what's possible for the future. And there'll be several priorities that guide us as part of that. One is co-designing our new strategy with communities, particularly the rural communities across the region. The second is deepening our intersectionality, especially for First Nations women, the LGBTIQA plus community, and generally those facing hardships. Growing place-based models and partnerships, particularly in the Mallee, and strengthening sustainability through diversified funding and innovative partnerships. So these priorities reflect not only who we are, but actually who we intend to become. And of course, none of this work happens alone. Our board, I want to thank for their wide stewardship. Our CEO Kelly and executive Sal and Belinda, I really want to thank you for your courageous leadership, particularly at a time of shifting terrain. Our staff, I wanted to explicitly acknowledge for lending their expertise and their passion, every day to this cause, and for bringing to life what's on paper. And to our partners and communities, I want to thank you for your trust and your collaboration and believing that we're an organisation that has something valuable to offer, which we do. So as we look to the future, I'm personally really filled with optimism. I think our region is resilient. I think our purpose as an organisation is really clear. And I think our community is full of people who believe in fairness, dignity, and opportunity. So from our perspective, 2025 has been a year of strengthening, preparing the ground, and now we are beginning to plant. So thank you. What I will do now is move to the CEO report. So I'd love to introduce our CEO, Kelly.
Oh my goodness, thank you so much, Sky. And it is with great pride and privilege that I stand or sit here today I guess help create this space for us in a formal way as part of an AGM where we need to, from a governance perspective, make sure that we are doing all the right things at all the right times, but more so with our spirit and our heart as we bring our work, our people, our relationships, the lands, everything together. I would also just like to extend the beautiful acknowledgement that Sky gave in creating and setting the scene for our AGM today, just to also include lived experience. And so wanting to thank with so much gratitude the lived experience voices, and with such courage and bravery, women, girls, trans and gender diverse people across the Loddon Mallee region sharing their stories with us, which we hold very sacred. I'd also like to highlight that this is slightly personal, but today is my 1 year celebration of being the CEO of Women's Health Loddon Mallee. So what a great day and date to have the AGM. And I look back, when I was writing my report, I was sort of, the looking in the rear view mirror, not fully turning around, because we need to always be looking forward to be safe as we're, the metaphor of driving. But I certainly looked back with such pride as to the day I started and the welcoming environment that the board, the staff and the community across Loddon Mallee have provided. Women's Health Service Network with our colleagues across the 12 sister organisations in this state doing such incredible work together. And I have such gratitude now as I share some of my reflections over this last year. Our key priority areas that we focused on were really continued from previous years, but really came into such a big focus as we start to use the portfolios that we're funded for, but what community is also telling us that they need to, what we need to advocate for, which covered a few different areas as we drove them together. So advancing gender equality, sexual and reproductive health, women's mental health, chronic disease prevention, primary prevention of violence against women and women in a changing society. We're really proud of the impact that we've had across these areas, and we really hope that as you engage in our annual report, which is amazing, the team have done a great job in our comms team, Tina and Corrine, in putting that together and helping our work come alive over the last year. So we really hope that you look forward to the continuation of that work and leveraging from the work that we've done previously as we strive to improve the health and well-being of women, girls and gender diverse people in Loddon Mallee region. I also reflected on leadership, which is a really great time to do that when you're starting as a CEO in an organisation, and one that for me is a continuing journey every day. And leadership to me, it's about building self-worth, resilience and purpose. So not just within me or ourselves as an organisation, but across our communities. Sky had already mentioned this, but I absolutely need to draw a reflection as well that social media and our comparison culture really erodes confidence, not just in individuals, workplaces, school environments, families, but in communities. So we want to counter this with acts of kindness and supporting one another, and that's how we endeavour to do our work every day. So every moment of empowerment is a step toward reclaiming the joy and strengthens our sense of agency and, of course, our purpose. We also celebrated, as Sky mentioned, 35 years of helping champion the health and well-being of women, girls and gender diverse people across Loddon Mallee. And we had the very great privilege of working with some of our previous leaders and our current leadership, with Sky as our chair and our current team, in putting together a short film that was beautifully crafted by Mitch Navalis, which helped us reflect on our journey, but also it brought together the importance of future focus and always a reminder from the leaders gone by that the work is not yet fully done. And in fact, this year has really told us that because of the experiences that we know women in leadership globally are experiencing. So in this time of international threats to women's health and autonomy, our work is more urgent than ever. And this is a moment to rally. So to evaluate and challenge leadership that silences women, girls and gender diverse people. This is also a time to embrace diversity and inclusion. So every day we have the opportunity to shape the future through policy, partnership, compassion and courage. I popped a quote in there from someone who I think is one of my mentors. I listen or I'm reading her books every day, and that's Brene Brown. And I really loved this quote, which was, "Courage starts with showing up and letting ourselves be seen." And I think that's something that we as a team are constantly reflecting to each other every day. When the narrative gets hard and when the work gets challenging, as our evidence and our incredible work might not be used in the way that we want it to be collectively across our sector, it's a time that we actually need to start showing up and again, making sure we take up space so that we can't be ignored. Collaborative partnerships, now they're essential to our primary prevention initiatives. So allowing for cross-sectoral connections and greater impact to reach our shared goals. So this year, Women's Health Loddon Mallee has continued to grow connections with a very diverse range of organisations, governments, clubs and community groups to help cultivate cultures of respect and equality across our whole region. Our whole narrative is also about that if we are able to gain that respect and equality level that we're hoping and achieving and that we know that is so important, that nobody misses out. In fact, when women, girls and gender diverse people feel compelled by the experiences of empowerment and of enrichment with their skills and their expertise to come to the table equally, whole communities benefit from that. So that is a message that we need to keep getting across. We've also helped provide advisory support and representation to many community groups and primary prevention of violence against women, gender equality, mental health and wellbeing, climate and health promotion networks, working groups and communities of practice within the Loddon Mallee region and across Victoria. And can I say, I am so esteemed every day to be showing up alongside an incredible team that are not only just skilled in what they do, but are dedicated with such passion. Research is not just research, it becomes so active as we talk about it constantly with the expectations of what we can do with what we know. And it's that beautiful analogy of when you know better, you do better. And that's where our team really kicks in and does such a great job. So I'd just like to finish off by thanking the board for their support, the community for their ongoing commitment to our work in primary prevention, but also a call to arms. We have still much to do, and I'm just so glad that I'm here in this space with you all, for the year ahead to continue to keep doing this work and show up in ways that maybe the world's never seen before. As Sky said, we're in strategic planning mode. We're pulling together incredible people, and we are ready to be bold and daring. Thank you, Sky.
Thanks, Cal. And, thank you for the last literally 12 months as CEO. So as we move forward, it's my pleasure now to introduce the board treasurer, Give Me Diaz.
Hello, everyone. I am glad to present the second treasurer report today. My name is Give Me Diaz. I'm the treasurer of the Loddon Mallee, Women's Health Loddon Mallee. So I'm honored to present the annual finance report for Women's Health Loddon Mallee at this year's annual general meeting. The financial statements have been audited by RSD Audit and are available on our website or via request. A summary of our financial position is included in the annual report, which is available on our website as well. I'm delighted to report that Women's Health Loddon Mallee received a mix of state government grants, including uplift of funds from the Department of Health and the Department of Families, Fairness and Housing. Total revenue for the year is 2,033,166. Total expenses for the year is to 2,357,509. So Women's Health Loddon Mallee ended the financial year ending 30th June 2025 with a board-approved operating deficit of 324,344, aimed at showcasing impact in the Loddon Mallee community in different ways. Our balance sheet remains robust with a healthy cash reserve. So that's about the financial report for the Loddon Mallee, Women's Health Loddon Mallee for the year ending 30th June 2025. So next item is to move and appoint the auditor for the 2025-2026 financial year, to appoint RSD Audit for the next year's financial audit as well. Yeah, that's all from Treasurer. Thank you.
So if I could please have somebody to move and second the acceptance of the financial statements for the financial year ending 30th of June 2025. Yep, we've got Melissa, seconder, Andrea, thank you. And then if we could have a mover and a seconder for the appointment of RSD as the auditor for 2025-2026. We've got Colleen. And we've got Andrea. It's always hard with is the hand a legacy hand or is it a new hand? Thanks, Andrea. Perfect. Thank you so much, Give Me, for all of your work as treasurer and, of course, from the staffing perspective, Sally, as well, for all of your work operationally. So moving forward, I will now hand over to Kelly, again, this time in her capacity as returning officer, to announce the board appointments.
Oh, thank you, Sky. Another privilege that I have is also being the returning officer. So we received nominations of office bearers as the incoming, returning officer. I can confirm that the number of nominations do not exceed the number of vacancies. An election was not required. We do have one vacancy on the board, which remains, and the board will look at filling that in due course. So as the returning officer, I declare that the following members are appointed for a 2-year period. We have Sky Kinder, Lisa Shafali, Githmi Dias, Catherine Heitbrink, Rachel Mason, and Colleen Condliffe. I can't see all, but I'm sure there's lots of applause happening in the background there. We also have some outgoing board members, and it's always with such sadness, but such gratitude for, it's a volunteer role, and just so grateful for the contributions made by these 3 board members who are outgoing. So Andrea Boudville. So Andrea, thank you for putting your hand up so much in this meeting, because at least you are well represented in the minutes for, for the last meeting that you're attending. And thank you for all your contribution. Penny Wilkinson, and I don't think Pen's on, but massive thank you to Penny for all the contributions that she gave to the board, and of course the incredible Fiona Fawkes. So between those 3 board members, there was much skill and care given to helping the guidance and governance for the board over the last 12 months, and for some of the board members longer than that. So I would just like to recognise their contributions, and the team at Women's Health Loddon Mallee, and I'll speak on behalf of Sky here, would like to also say thank you very much for your involvement and your value contribution. Sky, I'll hand back over to you.
Thanks, Kel. So it'll be a pleasure to work with our continuing board members, and also our mixture of returning and new board members, Colleen, Githmi, Lisa, Catherine, and Rach. It's going to be a fantastic 2026, I think. In terms of other matters, nobody has brought any other matters before the meeting. And so we actually have the great opportunity now to spend time on the part of the AGM that I'm sure everyone is most looking forward to, which is actually portfolio highlights from our staff. So what I'll do is I'll hand over to Kelly to introduce Belinda Buck.
Thank you, Sky. And my goodness, I now have the great pleasure in introducing to you all someone who most of you know very well, because she was an incredible interim CEO before the appointment of my appointment. So 12 months ago, she was still guiding me through this role. And that is Belinda Buck, who is the Director of Strategy, Partnerships and Programs here with Women's Health Loddon Mallee. Belle, I'll hand over to you to now introduce some of the team and the projects.
Oh, thanks, Carl. That was a lovely introduction. Nice to see you all. For those who don't know me, I'm Belinda, and I've got a great little segment here. I'm just going to be introducing some of the team, which is fabulous. We've had some incredible programs and initiatives that have been undertaken over the last financial year, which many you'll find highlighted in the annual report. But it's nice to see some being brought to life this afternoon that we will get to showcase. So we have 2 that we'll be getting to share with you. So the first one will be our health promotion lead, Sarah Quirk, and she's going to be talking about a project called Raise the Equal, which has a focus on gender equality in the early years. And then that will be followed by a presentation from Alison Jones, one of our wonderful health promotion leads. And we had the opportunity to undertake a huge piece of work where we developed a mental health and wellbeing strategy for the region called Her Mental Health Matters. And so Alison will be providing some insights in how that was undertaken and the key highlights from that project. So without further ado, I will first hand over to Sarah, who will talk to us more about Raise the Equal.
Thank you, Linda, and hi everyone. I'll just share my screen. Sharing sound. Right. Thanks, everyone. So, as Belle mentioned, my name's Sarah and I'm a health promotion lead here at Women's Health Loddon Mallee, and I'm so excited to be able to share the Race and Equal project with you. So this has been such a wonderful project to be part of, and we've created some really amazing resources along the way. The project has been ongoing for the past 5 years, and I just want to take a quick moment to highlight some of the important work that's brought us to where we are today. So in 2021, we received funding from the Department of Families, Fairness and Housing for a project focused on preventing family violence in multicultural and faith communities across the Loddon Mallee region. So during the first 2 years, we worked closely with our bilingual women's health team to deliver workshops with Karen and Filipino communities and community leaders. Before stepping into this role, the bilingual health team undertook a range of capacity building activities to strengthen their own knowledge and confidence around gender equality and family violence prevention. So this groundwork was essential, and it meant that when they began leading community workshops, they were equipped with both the skills and cultural insight to guide meaningful, respectful conversations. Their leadership helped bridge language and cultural gaps and ensured the project was shaped by the voices and experiences of communities themselves. So these workshops were incredibly well received, and many participants shared their motivation to challenge gender stereotypes in parenting and caring for children, showing just how impactful this work can be. So building on those first 2 years, the project focuses on early childhood, ages 0 to 5, as a critical life stage and setting for supporting children to develop positive, equal and respectful relationships, as well as their sense of identity, safety and happiness. So we've developed a range of resources to strengthen the capacity of the early years sector to work with families and multicultural communities to help nurture gender equitable attitudes and behaviours from the very start, and in doing so, prevent gender-based violence.
Come on, kids, give us a hand here. How about getting started on tidying away those toys?
I don't want to tidy up. Me neither. I want to play.
In our family, we share the jobs.
In our family, we share the jobs.
Children look up to their parents, grandparents and caregivers as role models. Our actions and behaviours help to shape our children's behaviours, expectations and understanding of the world. Let children see everyone in the household contributing to a variety of tasks and responsibilities. By sharing jobs in the home, we teach our kids that everyone needs to contribute equally, regardless of their gender. When we show respect for one another and demonstrate equality in the home, we are modelling a world where families and relationships are safe and respectful, and a place where children can thrive.
So the Raise Them Equal animations and conversation starter activities are tools for early year settings, communities and families to spark conversations about gender equality and how we can raise our children as equals. So the resource includes conversation cards that link to a 5-part animation series, and each animation explores a different theme around equality, showing how children absorb messages about gender from the world around them and how adults play a key role in shaping what they do. Each animation is paired with conversation starter questions to encourage practical discussions on how to challenge outdated stereotypes, norms and messages about gender. To help turn these conversations into action, we also created 25 pledge cards And these give families, groups, or individuals the chance to choose a simple, meaningful action that they'll commit to. So, for example, I will practice positive gender role modelling, or our household will commit to the sharing of equal household tasks. The animations and conversation starters are currently available in English, Karen, and Tagalog languages and can be viewed and ordered from our website. So alongside the animations, we've also developed a range of tools to help early years services put this work into practice. This includes a toolkit which outlines the project, its resources, and practical steps for using them in early years settings. The workshop aims to build understanding of why promoting gender equality in the early years is so important and gives early years professionals the confidence and skills to use the resources effectively. The promotional package helps services and organisations to share the project with ready-to-use content for newsletters, websites, and social media. We've also pulled together a collection of supporting resources, including podcasts, videos, research, frameworks, and a large selection of children's books, all to help families and communities promote gender equality in the early years and raise children free from gender stereotypes. So far, more than 150 settings have received resources, and this includes playgroups, multicultural playgroups, kindergartens, long daycares, libraries, preschools, and community learning centres, just to name a few. And we're really excited to be able to continue this work over the next 12 months, where we'll be focusing on translating the resources into an additional language to extend our reach up into the Mallee region of Victoria, and developing some new materials to further support families, communities, and early years settings in raising children to their full potential. So thank you so much for your time and interest today. I'll get back to you. Showing my screen.
Thanks so much, Sarah. That was beautiful. What a great presentation. I'm up next. So my name's Alison Jones, and I hope I do as well as Sarah did. I'm just going to share my screen as well, and I'm really delighted to be here. It's such I like to come and meet the board and to be part of this and share some work that I'm really proud of as well. So I'm just going to share my screen. Just press the wrong button. Here we go. All right. Excellent. That looks like that's doing that as it should. So for over in the month, excuse me, just before the when we look at the reporting cycle, I've been working on Her Mental Health Matters, a regional mental health and wellbeing strategy to support women, girls, and gender diverse people to thrive. The reason that we've been doing this is that Women's Health Loddon Mallee have a vision, and that's that individuals are empowered to stay well and protect their mental health throughout their lives, that diverse voices and experiences are valued and amplified, and that meaningful connections are supported for everyone in our community to have the social, economic, and environmental conditions that they need to thrive. Which very much resonated with what Sky was speaking about in her introduction. So it was great to hear that. And to achieve this vision, we need a strategy, a comprehensive roadmap that's going to help guide our health promotion efforts over the next 3 years. We built the strategy in partnership with our community. We reviewed the current evidence, and we brought together local health services, including Aboriginal health services, community health, the Public Health Unit, and the Public Health Network, and formed a working group to guide the strategy and its design. And we heard directly from women in our region through surveys and stakeholder interviews. All of these insights were analysed and brought together to shape the strategy's vision, priorities, and action. From our community, from the regional women within our community, we heard that regional women face distinct barriers and challenges when it comes to mental health and well-being, and that includes gender inequity, gender-based violence, and intersectional forms of discrimination across the life course, increased risk of loneliness, isolation, and homelessness, limited access to services and fewer opportunities for community connection and support, And we heard deeply that women prioritise caring for others, facilitating other people's social connections over their own, and that these gendered expectations often mean that women's mental health comes very much last at the list, at the end of the list. So we're really proud of our strategy that's going to help us challenge some of these societal norms. It's going to help strengthen community connections, and it's going to help us advocate for gender responsive access to supports and services, ensuring that help is available when and where it's needed for women in our community when they need it. So we identified, excuse me, that's not the right slide. We identified 5 strategic priority areas that are going to be key areas for actions, both for ourselves and for our stakeholders. And the first priority area is for enhancing local evidence. We want to build a stronger, more inclusive evidence base that amplifies lived experience. One of the ways that we will be doing this in 2025 is our project that begins focused on mental health, gender and housing as a social determinant of health. As we go about this, we're going to create safe spaces for women to share their experiences and explore the mental health impacts of housing affordability, safety, security, availability and accessibility. I'm excited for that project to kick off later this year. Our next priority area, a strategic priority area, is around strengthening community connections, creating opportunities for connection and belonging. We really heard from women, and we continuously hear from women, that there's lots going on in their communities, but they're not always sure where it is or how to find it or whether or not it's welcoming. We know that we're not the experts in every space, and we're very much committed to building partnerships, particularly with our First Nations and multicultural and LGBTIQA+ communities, to ensure that our work reflects the diverse needs of our region. And a really beautiful example of this work is our Aunties on Country program for First Nations women, which was, I had very much the privilege of working with a group of First Nations women. And we've brought them together 5 times so far, and it's been an absolutely wonderful project to be working on. I hope to be able to share more of that with you. Our third strategic priority is around addressing barriers to support. We really want to make it easier for women to find and access inclusive, gender-responsive mental health services. As part of addressing barriers, we also need organisations to embed gender equality into their policies and practices. And at Women's Health Loddon Mallee, we're actively supporting organisations to complete gender impact assessments on their policies and programs. Strategic priority 4 is around empowering individuals to protect and improve their wellbeing. We want to equip women with the knowledge, skills and confidence to look after their mental health. As part of my role, I deliver the Let's Talk mental health information sessions across the region, which brings accessible community-based education to where it's needed. We've got 5 other priority areas at Women's Health Loddon Mallee, and mental health intersects with all of them. So when we speak about mental health literacy, we have to make sure that people understand that for sexual and reproductive health, the impacts of family violence and the gender pay gap, how that all impacts on our mental health and wellbeing. We know very much that empowerment is prevention. And our last priority area is around embedding mental health in community settings, integrating mental health initiatives into everyday environments. And a recent example of this work is our active bystander training for young people, equipping them with the tools to safely challenge gender-based violence whenever they encounter it. We're also working on a drought project to raise awareness of the gendered mental health impacts of climate change, emergencies and disasters. And this very much leans into Sarah's work in Raise Them Equal as well, in terms of working with childcare centres to really change that understanding of what gender is from a very young age. We launched our regional mental health strategy. I think I'll stop sharing my screen now. This is the little snippet of the launch itself. But we launched the strategy in September on the 18th. It was open to both community and the workforce, and the purpose of sharing the strategy was to really demonstrate how the strategic priorities could be applied. The launch included our consultant, Lauren Zappa, giving a background on the engagement approach and the data collection that informed it. We gave an overview of the 5 strategic priorities of the strategy in a bit more detail than I've been able to do today. And then we had 3 wonderful guest speakers. We had Sarah from the Loddon Mallee Public Health Unit. We had Liz from Women with Disabilities Victoria. And we had Liz and Libby from Mind Australia, who all joined me at the end of the presentations for Q&A, and it was really well received. We recorded the event and shared it with 22 people who registered. And if you missed it, you can find the recording on our website, which I think Tina's dropped the link for in the chat. I think what's most particularly important about this strategy is that Her Mental Health Matters is not just a strategy for us. It's not just a strategy for Women's Health Loddon Mallee to follow. It really is a call to action. And it reminds us that us and our stakeholders that improving mental health requires a collective effort and one that's responsive to what women want and need. So the strategy is written, it's launched, and it's out there in the world. And now it's all about activating it. And I am very pleased to share with you that we're already well on our way. So thanks for having me again, and I shall hand back to you, Sky. Thanks very much.
Thank you. Thanks so much, Sarah and Azzy, for sharing some of the amazing work that you all do at Women's Health Loddon Mallee. We are in the fortunate position of having a little bit of time for questions. If anybody who's joined us today would like to ask a little bit about any of the projects that we have, or have any questions more broadly about Women's Health Loddon Mallee that they'd like to put forward. They were pretty comprehensive presentations, so you may well not have any questions, and that's fine too. All right. Well, in that case, we love an efficient AGM. It's much better than the alternative. What it is a privilege to have been serving as chair for the past 12 months, and to be reappointed to the board for another 2 years. We are so proud of the work that this organisation has done, and we are really excited, I think, to see the impact that this organisation is going to have in the future. So with that in mind, it's my privilege to bring this AGM to a close for 2025. Thank you all.
Thanks, Sky. Thanks, everyone, for coming.